Hello, welcome back to another CT Registry review. These are the practice test questions and answers for artifacts. I had someone comment on my channel recently and they asked me if I could add more artifacts, questions in, and I also have like a full video on artifacts already in my playlist. I will link it at the end of the video. So if you could please like, share, and subscribe for more videos. Also, feel free to leave a comment. If you want new videos added, just let me know. So if you are new to my channel, I like to read the question, the answer choices. I'll pause the video for a moment to give you time to think of the answer. If I am going too fast, just pause the video or rewind it. If the audio is bothering you, you can also just turn down the volume or you can mute the video. So here we go. Question 1. Which artifact causes hyperdense streaking when the anatomy is not in the correct scan area? A. Metal artifact. B. Patient motion artifact. C. Step artifact. Or D. Out of field artifact. All right, the correct answer is D. Out of field artifact. This artifact is seen on a CT image when a portion of a patient's body is positioned outside of the scan field of view. So make sure that the patients are properly aligned and centered to avoid this artifact. Question 2. Streaks on the final CT image is caused by A. An increase in the number of detector rows. B. An increase in pitch. C. Detector malfunction. Or D. Thin CT slices. All right, the correct answer is C. Detector malfunction. And it is also caused by tubes and detectors being misaligned as well. Question 3. Metal artifacts can be reduced or controlled while viewing it in the moment by A. Adjusting the window width and window level settings. B. Decreasing the KVP. C. Increasing the field of view. D. Increasing the pitch. All right, the correct answer is A. Adjusting the window width and window level settings. So you want to make sure, number one, that the patient does not have any metal that can come off, such as their zipper on their pants, probably like a necklace, hair clips, something like that. But if they do have like a surgical metal implant, you can remove it, like dental implants, metal in the knees, hips, things like that. So after the final image have came up, you can just take your mouse and move the cursor left and right, up and down to adjust the window width and window level settings. Question 4. When a structure is not positioned correctly within a voxel, the object is not correctly represented by a pixel value. This is called A. Beam hardening. B. Partial volume artifact. C. Step artifact. Or D. Out of field artifact. All right, the correct answer is B. Partial volume artifact. Question 5. Which artifact has an unsharpness or haziness appearance along the borders of an object? A. Beam hardening. B. Partial volume artifact. C. Step artifact. Or D. Out of field artifact. All right, the correct answer is B. Partial volume artifact. Question 6. Which area is a common area for a partial volume artifact to occur? A. Heart. B. Spinal cord. C. Posterior fossa. D. Spine. All right, the correct answer is C. Posterior fossa. The posterior fossa and between the diaphragm is a common place for a partial volume artifact to occur. Question 7. Which artifact has areas of light and dark streaking bands that occurs across the CT image? A. Beam hardening artifact. B. Cone beam artifact. C. Partial volume artifact. D. Step artifact. All right, the correct answer is A. Beam hardening artifact. Question 8. Cone beam artifacts are caused by A. Beam hardening artifact. B. Edge gradient artifact. C. Equipment induced artifact. D. Step artifact. All right, the correct answer is C. Equipment induced artifact. Cone beam artifacts becomes worse when the number of detector rows have an increase. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos? Thank you so much. Question 9. This artifact occurs between dense bone and surrounding tissues. What is the name of this artifact? A. Edge gradient artifact. B. Equipment induced artifact. C. Partial volume artifact. D. Step artifact. All right, the correct answer is A. Edge gradient artifact. Question 10. An artifact caused by an insufficient number of data samples is called A. Allison artifact. B. Partial volume artifact. C. Step artifact. D. Tube arcing artifact. Right. The correct answer is A. Allison artifact. Question 11. Which body part will you most likely see an indication of an out of field artifact? A. Head. B. Cervical spine. C. Shoulders. D. Spine. Right. The correct answer is C. Shoulders. So this happens when the anatomy is too large for the scan field of view, just in case you see this. Question 12. Which artifact is caused by a faulty detector in CT? A. Alexine artifact. B. Cone beam artifact. C. Ring artifact. D. Windmill artifact. Okay, the correct answer is C. Ring artifact. Question 13. An increase in pitch during a volumetric acquisition is A. Allison artifact. B. Cone beam artifact. C. Ring artifact. Or D. Windmill artifact. All right, the correct answer is D. Windmill artifact. Question 14. Which artifact occurs at the superior portion of the skull? A. Cupping artifact. B. Allison artifact. C. Cone beam artifact. Or D. Ring artifact. Right, the correct answer is A. Cupping artifact. So a cupping artifact is another word or another form of partial volume artifact that occurs at the superior portion of the skull. Question 15. Which technique may help to reduce beam hardening artifacts? A. Decreasing the KVP. B. Decreasing the scan field of view. C. Increasing the KVP. Or D. Increasing the scan field of view. Right, the correct answer is C. Increasing the KVP. Question 16. The posterior fossa is a common area for A. Beam hardening artifacts. B. Equipment-induced artifacts. C. Motion artifacts. D. Step artifact. Right, the correct answer is A. Beam hardening artifacts. All right, so that's it. We made it to the end of the video. Thank you all for watching. I do have a previous video out already in my CT Registry Review playlist where I do talk about the artifacts in CT. So you can click on the video that I have on the screen, and then I'll also put the playlist for my CT videos like for you to click on right now. So if you did find this video helpful, and want me to start making more or keep making more, could you please like, share, and subscribe for more videos from me? Thank you all so much for watching. I look forward to reading your comments. Let me know if this is something that helped you when studying for your artifacts in CT. Thank you. See you next time, and bye.